Okay, this is going to be filmed for Regis 650 Nursing. Do you give me permission to film you?
Yes, I do.
Thank you. Okay, so I'm starting with hand hygiene. My name is Alyssa. I'm going to be your nurse today. We're going to do a musculoskeletal assessment on you.
Okay.
So I'm going to stand a little bit far away from you because we're social distancing. But the first thing that I'm going to do is, now turn towards me just a little bit, face straight on front of me. Okay. So I'll be able to inspect your shoulders and your clavicle and your posture, look for symmetry, see if I can see any sort of deformities or masses or anything. I'm going to come in, I'm going to palpate your shoulders for any, and your clavicle for any bumps or masses or depression, see if I feel any edema or erythema or crepitus, and again assess for symmetry. I'm going to palpate the back of your neck for any tenderness. And I'm also going to palpate your TMJ joint. So I'm going to have you open your mouth wide. Okay, good. Assess for symmetry, any clunks, any crepitus, if there's any pain or warmth or edema when you're doing that. So then I'm going to assess your upper extremities. I'm going to feel down each arm for any warmth, any edema, any crepitus, assess the temperature. I'm going to assess each one of your fingers, look for any clubbing or cyanosis. I'm going to do the same thing with the other arm. Okay, good. Now I'm going to assess your range of motion. So first, I'm going to have you shrug your shoulders up, good, and down. Now I'm going to assess the range of motion of your neck. So I'm going to assess for flexion. I'm going to have you put your neck down towards your chest. Okay, and up for extension. Good. Now look side to side for rotation, and then push your ear to your shoulder for lateral bending. Okay, you have good range of motion in each direction. Now we're going to assess the range of motion of your shoulders and the rest of your arms. So I'm going to have you extend your arms up way above your head as high as you can. Good. This is flexion, and then put your hands behind as far as you can. Oh, that's okay. Okay. Now I'm going to have you put your arms up, out, and out to the side. Okay. That's for abduction. And then you're going to bring your arms across in front of you. Good. For adduction. Okay. Now, we would do all of that, including the head and neck range of motion, and that normally we would do it again against resistance. So I would have you lift up your arms against my hands, trying to push them down, and vice versa. But I'm going to stay far away. So then we're going to assess your elbow range of motion. So I'm going to have you flex up and extend down. Good. And then again, we would do that against resistance. So, and then I'm going to have you put your hands out like this and turn down for pronation and supination. And then I want to test the range of motion for your wrists. So I'll have you put your wrists out and turn up and down and in and out. And again, we would do that against resistance also. So I'm going to assess the range of motions against your fingers. So extend your fingers out and put them in. And then I would have you grip my fingers to assess your grip strength, so you can pretend. And I would have you extend your fingers, abduct your fingers against my resistance, and same thing, try to go against resistance. So now I'm going to assess you for a rotator cuff issue, if that would be your complaint. So I would put my hand on your scapula and try to raise your arm up to assess for a near impingement sign. And if that caused pain, that would be a positive sign. We could also test for the supraspinatus test. So this, I would have you hold your hands out and turn your palms out. And then I would push down on your arms and have you fight against the resistance. If that caused pain, that would be a positive test and could indicate a rotator cuff injury. Now I'm going to do the Tinel test to assess for carpal tunnel. So I would have you hold your hands out like this, and I would tap along the median nerve, and if it elicited pain throughout your first 3 fingers or tingling, that would be a positive Tinel sign and could indicate carpal tunnel. And then a Phelan sign, I would have you put your hands, the back of your hands together this way. This could also cause nerve impingement and could indicate carpal tunnel. That would be a positive Phelan test. So now I'm going to have you stand up and I'm going to look at your spine. So I would have you turn around and I would palpate down the back of your spine and your scapula, assessing for symmetry and any pain, any signs of scoliosis, kyphosis, lordosis. I'm going to have you turn back to me, and I could have you take a few steps to assess for an even gait and a solid gait, and that your gait was steady. So now I'll have you flex forward, bend forward. Good, and put your head down, and I can assess for the symmetry here and evenness of your scapula, and see if you have, see if your spine is in a straight column. So then I'll have you stand up and assess for spinal extension. I'll have you stand back like this. Good. And then I'm going to have you can come back. Okay. Now rotate side to side. Good, okay. And assess for lateral bending. And here I can see, and then I'm going to have you sit back down. Okay, that's good. And we will assess your knees. So I could palpate, assess for any warmth, edema, any crepitus, any signs of joint effusion. I could move the patella around a little bit, see if there's any tenderness. So I'm going to have you extend your knee, kick it out. Good. And back in for flexion. Good. And then I'll have you turn your ankle in and out. And then we'll do the same thing with the other leg. Extension and flexion. And then abduct the ankle, adduct the ankle, and abduct the ankle. Okay, so now I'll have you lay down. Okay, and we could use the McMurray test to assess for any meniscus damage or meniscus pain. So I would bend up your leg. And then I'm going to rotate, abduct your ankle in, and try to straighten out your leg. Okay. If there was any clicks or clumps or pain, that would be a positive McMurphy's test. And then abduct and try to straighten it out. And no clicks or clumps. And then we could do the same thing on the other side. So now I'm going to assess for your hip range of motion. So I'm going to have you extend your leg and then put it back down. And then the other one, put it back down. And then I'm going to have you abduct your leg out to the side. Good. And then adduct it over the middle. Okay, good. You can put it back down. So now we'd assess for internal and external rotation. So you're going to bend up your leg. Keep your foot down. Yeah, you put your foot down. Good. And then you're going to let your knee fall out. And then back in. Good. And then we would do that on the other side. And then repeat all of this also against resistance. So now we can inspect the range of motion and strength of your feet. So I'm going to have you push down against my hands. Good. For dorsiflexion and up. For plantar flexion. Okay, good. And you can rotate your ankle in and rotate out. Good. And we would be assessing the feet for any bony prominences, any pain, any deformities, any asymmetry, looking for clubbing and cyanosis. And then we could also assess for ligamentous injury of the knee. So we could do the varus test. So we put the knee be just shy of full flexion, and we could push medially on the ankle and slightly laterally on the knee, and then the other way, slightly lateral on the ankle and medial on the knee. And if there was pain and discomfort, that could be a positive varus test that could indicate a ligamentous injury. Another method would be the drawer test, the anterior and posterior drawer test. So we have you bend up your knee, and grasp behind the knee and push forward a little bit to see if the tibia slides out almost like a drawer, and then posteriorly also, which it does not. Okay, so I'm going to have you sit up again. And one more test for your shoulders. We're going to do internal and external rotation. So I'll have you take, for external rotation, I'll have you take your hands above your head and put them back behind your head. Good, like that. And then for internal rotation, you'll take your hands and put them, try to reach for your scapula. And again, all of these tests would be done against resistance also.